Bonjour et merci de vous être rejoint à nous aujourd'hui. Comme le Premier ministre a annoncé ce matin, à partir de ce soir, le gouvernement du Canada met à jour l'ordonnance d'urgence sur la loi sur la mise en quarantaine qui exige que toutes les personnes entrant au Canada, que ce soit par voie aérienne, terrestre ou maritime, doivent s'isoler pendant 14 jours. Avec la mise à jour de l'ordonnance, tout voyageur arrivant au Canada, qu'il soit symptomatique ou asymptomatique, est interdit de s'isoler dans un endroit où il serait en contact avec des personnes vulnérables, telles que des adultes de 65 ans ou plus ou des personnes de tous âgés ayant des problèmes médicaux préexistants. À leur arrivée, les voyageurs doivent également confirmer qu'ils ont un endroit approprié pour s'isoler où ils auront accès aux besoins essentiels tels que de la nourriture et des médicaments et où ils n'auront pas de contact avec des personnes vulnérables. Les voyageurs arrivant au Canada doivent prévoir à l'avance l'endroit où ils seront isolés ou mis en quarantaine. Tout voyageur qui ne dispose pas d'un lieu adéquat pour s'isoler ou se mettre en quarantaine doit se rendre à un endroit désigné par l'administrateur en chef de la santé publique du Canada. Il peut s'agir, par exemple, d'un hôtel. Ces nouvelles mesures obligatoires constituent une couche supplémentaire dans les actions du Canada visant à protéger la santé des Canadiens et Canadiennes. As the Prime Minister announced this morning, as of tonight at midnight, the Government of Canada is updating the emergency order under the Quarantine Act that requires all persons entering Canada, whether by land, air, or sea, to isolate or quarantine for 14 days. With the updated order, any traveler arriving in Canada, whether they are symptomatic or asymptomatic, is forbidden to isolate in a place where they would be in contact with people who are vulnerable, such as adults of 65 years of age or older, and people of all ages with pre-existing medical conditions. Upon arrival, travelers will also need to confirm that they have a suitable place to isolate, where they will have access to basic necessities, such as food and medicine, and will not come into contact with vulnerable people. Travelers arriving into Canada need to make plans in advance for where they will isolate or quarantine. Any traveler who does not have an adequate place in which to isolate or quarantine themselves must go to a place designated by the Chief Public Health Officer of Canada. This includes, for example, a hotel. These mandatory new measures are an additional layer in Canada's actions to protect the health of all Canadians. This follows conversations with many provinces and the new measures we announced together with British Columbia last week. The measures, which include a new legal requirement to provide a self-isolation plan, support provincial health officers' travel orders, and reinforce the federal emergency order under the Quarantine Act, requiring people entering Canada to self-isolate for 14 days. And now, today, we will hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, our Deputy Chief Public Health Officer, le Dr. Howard Njoo, by video link, the Minister of Northern Affairs, Dan Van Daal, et le Président du Conseil du Trésor, Jean-Yves Duclos. And, of course, with us is our Minister of Health, Patty Hajdu, available to answer your questions. So, Dr. Tam, please.
Bonjour, and I'll start with our usual update on the number of COVID-19 cases in Canada. So there are now 26,631 cases, including 823 deaths. These results, of course, change over the day. For the lab testing, we've completed tests for over 450,000 people, with now close to 6% confirmed positive, as Canada continues to improve our testing to track where the disease is spreading. These times have been challenging for all of us, but they can be especially hard for children. Children's daily routines have been turned upside down, and the things that they have most been looking forward to have been cancelled. As for us, it is for them. Silence and secrets do not protect children. Honesty and openness do. There are things we can do to help build resilience, like talking to kids honestly and reassuring them that we will get through this. Open discussion helps kids to sort fact from fiction, to look for ways to have some control, and to be mindful of their media consumption. We can also show children how to express gratitude for the efforts of everyone who is helping us through this time, like healthcare workers on the front line and all the people working to keep our essential supplies open and grocery stores stocked. At the same time, it's a lesson in all the many roles that people play all across Canada to keep our society running. Over the weekend, I was reminded that this April marks the 40th anniversary of Terry Fox's Marathon of Hope. Terry believed that anything is possible if you try, and that even one person can make a difference. Although Terry was not able to complete his journey, his spirit of hope remains with Canadians all these years later. Right now, we need to heed his message more than ever. The sacrifices we are making to maintain physical distancing are making a difference to slow the spread of COVID-19. So stay home, save lives, and let's give our best efforts to plank the curve. Then crush it. Thank you.
Thank you very much, Dr. Tam. Et maintenant, je donne la parole à Dr. Howard Njoo. Dr. Njoo.
Oui, merci. Bonjour. On commence tout d'abord par faire le point sur le nombre de cas de COVID-19 au Canada. On compte aujourd'hui 26 631 cas de COVID-19 au pays, dont 823 décès. Ces résultats changent de jour en jour. Nous avons effectué des tests de dépistage sur plus de 450 000 personnes, dont près de 6% ont été déclarés positifs à la COVID-19. Le Canada continue d'améliorer les tests pour mieux suivre la propagation de la maladie. La pandémie est difficile à vivre pour toute la population et surtout pour les enfants. Leur quotidien a été bouleversé et des activités qu'ils attendaient depuis longtemps ont été annulées. Le silence et le secret ne protègent pas nos enfants. Comme aux adultes, il faut leur parler avec honnêteté, en toute transparence. Nous pouvons aider nos enfants à cultiver leur résilience. Il faut les rassurer que ça va bien aller et leur expliquer les choses clairement. Parler aux enfants en toute franchise les aide à distinguer le vrai du faux, à prendre conscience qu'ils peuvent contrôler leur situation et à développer un regard critique sur leurs relations avec les médias. Nous pouvons également expliquer à nos enfants l'importance d'exprimer leur gratitude pour les efforts de ceux qui nous aident à traverser cette période difficile, comme les employés du secteur de la santé et ceux qui travaillent dur pour que nos magasins ne manquent de rien. Ces conversations sont une belle occasion de parler à nos enfants du rôle joué par différents membres de la société canadienne pour qu'elle fonctionne bien. Le mois d'avril 2020 marque le 40e anniversaire du Marathon de l'Espoir de Terry Fox. Pour Terry, tout était possible et même une seule personne pouvait faire une différence. Même s'il n'a pas pu terminer son parcours, il demeure pour les Canadiens un modèle d'espoir qui continue de nous inspirer 40 ans plus tard. En effet, le message de Terry Fox n'a jamais été aussi important qu'il est aujourd'hui. Chaque sacrifice que nous devons faire pour maintenir l'éloignement physique contribue à freiner la propagation de COVID-19. Alors, restons chez nous pour sauver des vies et acharnons-nous à aplatir la courbe le plus rapidement possible. Je vous remercie.
Merci, Dr. Njoo. And now we will hear by video link from Winnipeg from our Minister of Northern Affairs, Dan Vandal. Dan, please.
Oui, bonjour, good morning. Since the COVID-19 crisis started, I have been in constant communication with territorial premiers as well as First Nation, Inuit, and Métis nations and partners across the North. Their concerns, their ideas, and solutions have been informing our response COVID-19 in the North since day one. We recognize that many Canadians are facing financial hardship, and they are concerned for their health, their jobs, their loved ones, and their neighborhoods. This is especially true in Canada's North. There are exceptional challenges in meeting the unique needs of Northerners in this pandemic. Le mois dernier, nous avons annoncé un financement de 305 millions de dollars pour aider les communautés et les organisations autochtones à travers le Canada à répondre aux besoins immédiats liés au COVID-19. Ce financement s'ajoute au soutien fondé sur les besoins en santé et de gestion des urgences des Premières Nations et des Inuits et vient appuyer les autres mesures financières qui sont maintenant à la disposition de tous les Canadiens, incluant les Premières Nations, les Métis et les Inuits. Territorial governments have identified their critical priorities to prepare for and to respond to the COVID-19 pandemic and to avoid the spread of the virus. Today, we are announcing significant next steps to address concerns facing the North, including support for healthcare, for nutrition, and for air transport. The Government of Canada is transferring $89.9 million to the territorial governments to assist with health preparation and response and to support continuity of air transportation services to northern communities. The majority of this funding is primarily for territorial healthcare systems, including critical healthcare needs, preparedness, and mitigation efforts. And as we know, airlines are a critical link to maintaining the supply chain for the movement of essential goods and services. In order to do this, the Government of Canada is providing $17.3 million in immediate relief to support critical air transportation links on key essential routes in Nunavut, the Northwest Territories, and Yukon. Le financement d'aujourd'hui s'appuie sur les 500 millions de dollars qui ont déjà été annoncés le 11 mars pour les besoins essentiels des systèmes de soins de santé provinciaux et territoriaux et pour soutenir les efforts d'atténuation qui tiennent compte de l'augmentation des coûts et des circonstances particulières auxquelles sont confrontés les gouvernements territoriaux. We also recognize the increased cost of many essential goods in the North. Families are facing increased financial pressures and should not be worried about how to pay for nutritious food or essential household supplies. That is why we are investing an additional $25 million to Nutrition North Canada to better support Northern families in accessing sufficient, safe, nutritious food by increasing the subsidy rate on basic and essential goods that families depend on. We have also added cleaning and personal hygiene products to the list of eligible items of Nutrition North Canada to all northern communities. I'm also very pleased that funding for the first year of the Harvesters Support Grant has been allocated to Indigenous nations and partners, and we are working diligently to flow the next wave of money quickly. This grant, co-developed with Indigenous partners, helps Northerners return to traditional harvesting and food sharing practices by alleviating the high costs associated with traditional hunting and harvesting of foods. As you know, this crisis is evolving very rapidly, and we recognize that we will continue to support the health, safety, and the well-being of Northerners. We will continue to collaborate with territorial, provincial, and Indigenous and other partners to determine future responses as part of our ongoing efforts to fight COVID-19. By ensuring we maintain our physical distancing, by staying home, and by connecting remotely, as I am today, we can plank the curve and get through this together. Thank you, merci, and miigwech.
Okay, thank you very much, Dan. Et maintenant, je donne la parole au président du Conseil du Trésor, Jean-Yves Duclos. Jean-Yves, s'il vous plaît.
Merci, Christia. Hello, everyone. Bonjour tout le monde. Le message du Premier ministre ce matin, c'est un message de protection. Protection tout d'abord de ceux et celles qui nous protègent aussi dans les soins de santé. Donc un message de collaboration entre les provinces et les territoires pour la l'approvisionnement, mais aussi la distribution de matériel de protection, de tests et de traitements tellement importants pour nos travailleurs en milieu médical. Le deuxième message de protection, c'est celui que le ministre Vandal vient de nous résumer, c'est-à-dire de protéger les gens qui habitent dans les territoires en milieu nordique qui font face à des défis substantiels en matière économique, de santé, de services sociaux, mais aussi en matière de transport et d'alimentation. Le troisième message de protection, c'est celui pour nos aînés qui vivent dans des résidences et dans des milieux de soins de longue durée, qui vivent difficilement, mais qui ont besoin et qui profitent de l'appui de tous ces travailleurs de première ligne qui sont là pour les aider. Donc, le partage de lignes directrices avec les provinces et les territoires et ces échanges importants et fructueux qui ont lieu entre le gouvernement canadien et les provinces pour aider à rémunérer et à appuyer solidement les travailleurs dans ces milieux importants. Et le dernier message de protection, c'est celui de protéger à la fois la capacité de joindre les deux bouts, mais aussi la capacité de prendre soin de sa santé et de la santé de ses proches. Et là-dessus, bien, les nouvelles de la prestation canadienne d'urgence sont importantes. Au cours de la dernière semaine, le gouvernement canadien a reçu 3,5 millions de demandes de prestations canadiennes d'urgence. Depuis le 15 mars, c'est un total de 6 millions de demandes qui ont été reçues et un total de 5,4 millions de demandes ont déjà été traitées. So briefly in English, for the Canada Emergency Response Benefit, protecting the ability of Canadians to make ends meet and to look after their health and the health of their loved ones is in part done by the provision of the Canada Emergency Response Benefit. So a total of 3.5 million applications have been posted in the last week, a total of 6 million since March the 15th, and out of these 6 million applications, 5.4 million have already been treated. So that's for me. Christian.
Okay. Merci Jean-Yves et on est prêt à répondre à vos questions.
Okay, thank you, Deputy Prime Minister. As usual, we'll start with 3 questions on the phone and then turn to the room. 1 question, 1 follow-up, une question, un suivi. Opératrice?
Thank you. Merci. Please press star 1 at this time if you have a question. N'hésitez pas à appuyer sur étoile 1. Our first question is from Lena Bibb, La Presse canadienne. Please go ahead, la parole est à vous.
Oui, bonjour. Au sujet de cette annonce sur la quarantaine, j'essaie de comprendre pourquoi est-ce que ça a été nécessaire de faire ça maintenant. Je croyais que quand on avait annoncé que la loi sur la quarantaine allait être appliquée, la quarantaine devenait obligatoire pour les personnes qui y arrivaient là pour les 14 premiers jours. Alors, est-ce que vous avez remarqué quelque chose sur le terrain qui fait que c'est nécessaire d'en faire plus?
Merci pour la question. Vous avez raison. La quarantaine était obligatoire du début, mais on toujours essaie d'améliorer ce qu'on fait et on a décidé que ces mesures additionnelles donnera au gouvernement plus d'outils pour renforcer la quarantaine. And Patty, or? Okay. Dr. Njoo.
OK, oui, en français, c'est Dr. Njoo, oui. On a déjà l'ordre obligatoire selon la loi sur la mise en quarantaine, mais aussi avec le nouvel ordre, on a mieux précisé parce que les autres conditions, on sait c'est important pour les voyageurs qui arrivent au Canada d'avoir un plan pour vraiment préciser. Ils vont pas aller dans une accommodation avec les autres personnes vulnérables, avec des conditions médicales sous-jacentes ou une personne âgée plus de 65 ans. Ça, c'est important. Aussi, c'est important de préciser que avec le plan, il faut aussi indiquer que ils vont être dans une place où on a aussi accès aux des choses importantes, comme la nourriture, aussi des médicaments. Et aussi, on a même des petits détails. On va aussi fournir même un masque pour les voyageurs. Même ils sont asymptomatiques pour voyager à leur, comment dire, destination finale. C'est vraiment une question de peut-être donner plus de détails pour préciser qu'est-ce qui est exigé.
On suivi, Lina?
Aucun suivi. Notre prochaine question. Our next question is from Mike Blanchfield from the Canadian Press. Please go ahead. La parole est à vous.
Good morning, everybody, or good afternoon. I'm directing this question at the Deputy Prime Minister, but perhaps others will want to answer. The Leader of the Opposition this morning was raising questions about the World Health Organization. He said he has concerns about the reliability of their data, their relationship with China, and we've seen new reporting raising some questions related to this in recent days. So how much faith should Canadians have in the World Health Organization right now, and are there areas where the government should be exercising some caution or taking a second look at what they're being told by the WHO?
Thanks for the question, Mike. When it comes to medical expertise and health expertise, the first people we rely on are Canada's outstanding public health professionals, our great team here in Ottawa, and the public health professionals across the country. And we are very lucky in Canada to have an excellent healthcare system and very, very smart public health professionals. When it comes to international cooperation, I think we all appreciate that the novel coronavirus is a global pandemic, and that does require international collaboration, multilateral collaboration. The WHO is the international body that coordinates international response to pandemics. And so, of course, we work actively with the WHO. We also collaborate closely with other allies in other fora. Our Minister of Health has regularly been meeting with, including just last week, the G7 health ministers, for example. That's an important forum for us. And so is partnership with our allies around the world. Now, I don't know, Patty, if you would like to add anything?
Well, I'll just say a couple words. Yes, I think it's important to realize that I think that the WHO is not a standalone organization without multiple sources of research feeding into it. And when I think about the expert committee that Dr. Tam sits on, in fact, those committee meetings are extremely important for the world to coordinate its response to coronavirus. And I think that the Deputy Prime Minister is exactly right, that when we look at illness and disease in a global setting, in fact, we cannot defeat this virus or any virus or illness without our global partners. And we've seen that multiple times with a variety of different illnesses. So I think we have these structures internationally, and they play a really important role. And it is about the coordination of response. And I think, Dr. Tam, would you like to say a few words about the kinds of things that are discussed at the special committee that might help highlight what the kind of thinking has, how the thinking has evolved, for example, as the research has?
I think the WHO does consist of all of its member states, so of which Canada is one, but it taps into the global community of scientists, researchers, epidemiologists. So I think it has multiple committees, and some of them looks at research and development. Some of them will look at the surveillance and trying to keep the world appraised of the latest evolution in the virus, for example. So there are multitudes and many layers of sort of expert committees, and that is one of the key roles. For sure, nobody sort of can anticipate the sort of evolution in knowledge, of course, of this virus. So we knew very little at the beginning. People try to accelerate and get the information as fast as they can. I think as we progress, absolutely the whole world has to be able to provide epidemic control of this virus for Canada and the rest of the world to look at what the new normal might look like, because, you know, we are dependent on other countries also being able to control their illness. So I think now more than ever, international collaboration is actually very key.
Mike?
My follow-up question is, and I understand perhaps you may not want to be seen to be sowing doubt in a major international organization at this time. Be that as it may, Dr. Allward was supposed to testify this afternoon at the Health Committee and give an insight into the WHO. Now the official opposition is saying, well, that's unfortunate, that shouldn't have happened. And they want to know more about how Canada is engaging with the WHO in light of criticisms that continue to keep surfacing about whether or not one of those partners, China, has been living up to its obligations, perhaps, or not, in relation to its work with the WHO. So, could someone please address that concern that the WHO, that is raised by the leader of the opposition very clearly this morning in a press conference?
Well, I'll just add to what we've already said about the role of the WHO and its importance in terms of understanding sort of global pandemics and the trajectory of illness around the world and how we work together to manage that. But I will say, in terms of the Health Committee, we have been regular participants at the Health Committee, and of course, as I've mentioned, Dr. Tam is an expert advisor to the committee at World Health Organization that's been leading the response on coronavirus. And we've been available to the Health Committee at every request, and in fact spent numerous hours just a couple weeks ago, I think, Dr. Tam and Dr. Njoo and my deputy answering the questions of the Health Committee, and we'll continue to do that. This is, I believe, this is a time where we do need to pull together, not just internationally, but also nationally. This is an actual health crisis for Canada, and we work very hard to make sure that the opposition has an ability to ask those questions and has the information at their fingertips when they ask for it.
Thank you, Minister. Operator, next question, please.
Thank you. Merci. Our next question is from Micheline Laflamme de Radio-Canada. Please go ahead, la parole est à vous.
Oui, bonjour, merci beaucoup pour l'opportunité. Dites-moi, alors, quels sont, que vous demandent en ce moment les provinces pour les aider à faire face à la crise là, dans les centres de soins de longue durée, les centres de personnes âgées? Et M. Duclos, vous l'avez déjà évoqué, là, qu'est-ce que ça pourrait, à quoi ça pourrait ressembler, l'aide que vous pourriez leur apporter?
Merci et pour la question. Bien, c'est une aide qui s'étale à différents niveaux. La première aide à laquelle on pense ce matin, c'est celle à laquelle a fait allusion le Premier ministre, c'est-à-dire un partage de directives qui ont été d'ailleurs bâties en commun par la collaboration entre les provinces, les territoires et le gouvernement canadien, puisque évidemment on reconnaît la responsabilité et le rôle extraordinaire que jouent les provinces dans le contexte d'aider nos aînés. Le deuxième plan, je dirais, le deuxième aspect, c'est celui du partage d'équipements médicaux. Et on sait à quel point cet équipement est non seulement important au Québec pour les services hospitaliers, mais aussi les services dans les CHSLD et dans les résidences pour les aînés. Les équipements donc sont fournis et sont produits à une vitesse grand V, et on est conscient et certainement très heureux que ces équipements peuvent être en appui à tout ce travail que font les préposés, infirmières et autres en milieu de soins de longue durée et en milieu de résidence pour les aînés au Québec et ailleurs au Canada. Et la troisième chose, bien, c'est une discussion absolument importante que le Premier ministre Trudeau a annoncée dès lundi dernier, c'est-à-dire comment on peut assurer les conditions de travail qui non seulement vont attirer davantage de gens dans ces milieux si importants, mais aussi les retenir lorsqu'ils sont là et leur fournir une capacité de travail qui soit à la hauteur de leurs responsabilités.
Mais est-ce que vous envisagez... Oui, merci. Est-ce que vous envisagez offrir une aide financière pour justement faire face à cette crise, puisqu'on sait déjà que dans bien des centres, il manque de personnel, ils n'ont pas l'équipement qu'il faut. Alors, est-ce que vous êtes en discussion là, justement pour faire ce que le Québec a fait, mais offrir une aide financière à d'autres provinces?
Tout à fait. Il y a vous avez touché aux deux aspects importants. Le premier, c'est que le Québec a déjà commencé à faire quelque chose qui a été bien accueilli, je pense, par les Québécois, c'est-à-dire d'augmenter de manière importante la rémunération de ces travailleurs essentiels. Puis la deuxième chose, bien, c'est de constater qu'à travers tout le pays, les besoins sont semblables. Donc, comment est-ce que le gouvernement canadien peut apporter sa contribution potentiellement financière de manière à ce que les provinces et les territoires puissent continuer d'assumer ces responsabilités tellement importantes dans les milieux dont on parle.
J'ajouterais seulement que, bien sûr, que c'est une conversation avec le Québec, mais aussi avec des autres provinces.
Merci. On va maintenant prendre les questions dans la salle. Mike?
Hello. Can I ask you about, I'd like to continue on the long-term care facilities. Who are our leaders on this issue? Like, do we have anyone who's getting it right and that we can learn from?
Well, thank you very much for the question. And first of all, I would just want to thank Minister Deb Schultz for her work in working with her counterparts and with our team to come out with the long-term care guidance documents that are now posted. And I will say that there are some people getting it right, and it's slow, but it's coming. And I will say that some of the work that British Columbia, for example, has done on the permanency of those positions and paying care workers enough so they don't have to work in multiple homes or multiple facilities, it is unlocking some of the answers around how we reduce the transmission of the illness. I think there's the guidance is quite broad, and I'm sure if you take a look at it, you'll see just the number of recommendations. But I do think that there is a value in having a larger conversation about long-term care homes and the way that we manage those homes in general. Coronavirus and COVID will be with us for some time, and given the epidemiology that we know about this virus, right, the disease pattern that we know now, we'll need to be protecting our seniors for a long time. And I think there's an argument to be made that this has been an area that's needed some attention for a long time as well.
All right. And you mentioned BC, and I was wondering if there's any other provinces that are taking strategies that we could send across the board that they're really latched on, that's working, that we could apply across the country.
Well, I'll turn to Dr. Tam. She may have more detailed information from the work that she's been doing on the special committee.
I would say that every province and territory are really seized with, doing best practices. So you've probably seen them publicly updating Canadians on what they're doing. That actually includes things like restriction of visitors, the new recommendation about wearing masks and for shifts, and also looking at improving how the facilities itself can screen health workers, visitors, and residents. So they're all trying very hard to do this, and they're exchanging their ideas across the board at the Special Advisory Committee. So I think just even in the last several days, you've seen many provinces trying to really strengthen what they're doing, because knowing the epidemiology itself.
Ian Wood, CTV News. You've told us that Canada has relied upon the WHO for intelligence on a global level, knowing what's happening abroad, for information and data regarding COVID-19. But was Canada assisted by any other sources of intelligence, either within our own intelligence community or our Five Eye partners, in developing or in knowing what was going on abroad? And if so, when did we first get an alert from this intelligence source that there was a pandemic issue?
Yeah, so we actually scan global media and other open sources for information on a daily basis. We have a system in Canada called GFIN, the Global Public Health Intelligence Network, and we do that sort of from a public health perspective. And we were able to detect, as well as other public health intelligence sources, the actual unusual outbreak in Wuhan when we first were alerted right at the end of December, like the 31st of December and sort of January 1st and 2nd. And I had already communicated with the chief medical officers by the 2nd of January as soon as we thought, okay, well, this looks a bit unusual. That was before we even knew what virus caused this. So those kind of public health intelligence are very much sort of alive.
It's Dr. Njoo here. I could also add to that we also have very good personal contacts with our counterparts across the world, and including the U.S. And for myself personally, we had daily phone calls. I had daily phone calls with the head of infectious diseases at the CDC on the situation has evolved even from the beginning of January. So there was a lot of sharing of information between public health officials across the world, including between ourselves and the CDC. And
so my second question, I'll then direct towards the Deputy Prime Minister. intelligence experts have suggested, as we've just talked about, that we had an over-reliance on open source data, what was being given, say, to the WHO that we received, monitoring media, that sort of thing. So with regard to the intelligence community, when did we get intelligence from China that there was something bigger, greater than what was being seen on open source data? And was our intelligence community primed to act on these sort of the sort of information they were receiving?
Well, as you've already heard, Ian, our public health officials were very seized of this issue from the beginning of January, and were very involved in conversations both in Canada and around the world about what this novel coronavirus was. When it comes to Canada's intelligence partners and intelligence sharing, we have, of course, talked about the coronavirus with our intelligence partners very energetically throughout this crisis. For reasons of confidentiality, I'm not going to go into the specifics, but there has been, in addition to the work done by the public health officials, there have been intelligence conversations around this, particularly with our closest allies.
Julie Van Dusen, CBC, for Theresa Tam or Patty Hajdu, and it's about Jason Kenney and what he said about he wants to jump on tests and vaccines, circumvent Health Canada if it takes too long. He doesn't want to get bogged down by the bureaucracy, and he took some swipes at you about your positions on borders and human-to-human transmission. What do you say about that? And maybe you'd like to jump into.
Well, thank you very much. And first of all, I'll just say that we are so grateful, as a Deputy Prime Minister has said, to have the leadership of Dr. Tam and Dr. Njoo, and in fact the entire public health team and Health Canada, in fact, working day and night to help us as a country manage the coronavirus, COVID-19, and our response to it. I will also say that I also have confidence in how hard Health Canada is working to look at every potential tool, every potential drug, every potential avenue to both treat and protect Canadians. But I will also say that it's important, and I think Canadians would want to know this, that we validate these things using science to make sure that they are effective, that they are not dangerous, and that they are used in appropriate ways with scientific guidance. And so we work, as I said, extremely diligently, as always, but even more so now during this time. And I just want to thank the public servants for how hard I know they are working to expedite approvals of tests, for example, or other kinds of equipment that we need.
But Theresa Tam, maybe you could just answer. Do you think he's trying to undermine you?
Just so that I have had incredible collaboration with the chief medical officers, including, of course, the chief medical officer in Alberta, and we work really well together, and all of us are trying very hard that Canada across the board is giving us our best response. And I do think that I know our Health Canada colleagues have authorized a lot of tools that Canadians can use. And, you know, they sort of authorize 51 devices, 13 authorizations for test kits, 39 authorizations for non-in vitro diagnostic devices. The list goes on. But we do want to ensure safety and the actual effectiveness of these tools. And I think the health community understands that. And certainly we encourage also that the use of medications, that they be used in the context of clinical trials as well, because that ensures the fastest way to actually get some results as to whether they're effective or not and whether they are safe. So I think that's really important.
That would be a third question, Julie. We're already a little short on time, so we'll do one question on the phone.
Can I just add one final sentence, if I may, or two sentences? So, Julie, I think when it comes to Canada's response to the novel coronavirus, I would highlight two real strengths that we have shown as a country. The first is across the country, We have shown that we are a country that does believe in the value of expertise and in the value of science. At the federal level, that has meant we have understood the importance of our public health officials, Dr. Tam and Dr. Njoo, playing a central role. And in provinces across the country, the chief public health officers have been central to provincial responses. In municipalities across the country, chief public health officers have been central to municipal responses. I have observed as a former journalist that chief public health officers across the whole country have become this generation's rock stars, and that is entirely appropriate. The second strength of our national response, I think, has been very strong collaboration between the federal government and provincial governments. That's essential always, but it is particularly important when we face a shared health crisis, a crisis where provinces deliver frontline health care and where the federal government needs to play an essential role as well. Our approach is going to be to continue to build up and use those two core strengths of Canada's response.
Thank you, Deputy Prime Minister. We're already running short on time, so we'll take one last question on the phone before we turn back to the room for one last question. Operator?
Thank you. Merci. Our next question is from Raymond Fillon from TVA. La parole est à vous. Please go ahead.
Oui, bon midi. Les nouvelles règles de quarantaine pour les voyageurs, je voudrais juste avoir une précision. Pour les gens qui devront aller à l'hôtel, est-ce que ce sera à leurs frais à eux ou aux frais du gouvernement fédéral?
C'est Dr. Njoo ici. La réponse est simple, c'est le gouvernement fédéral qui paie les frais pour l'accommodation si on met quelqu'un dans un de nos, établissements selon la loi sur la mise en quarantaine.
Il y a des centres pour aînés, je reviens là-dessus, peut-être pour M. Duclos ou Mme Haidou. Je comprends qu'il n'y a pas eu de demande de la part des provinces pour une intervention des Forces armées canadiennes, mais est-ce que le personnel médical des Forces canadiennes pourrait aider le personnel dans ces centres pour aînés qui sont débordés?
Patty, go ahead.
Nous avons un portal pour les personnes qui veulent volontaire pour aider les provinces avec beaucoup de choses, incluant les personnes qui travaillent les centres d'aînés.
Et les gens médicaux dans la Force armée du Canada aujourd'hui sont engagés en tant que professionnels dans le travail autour du pays contre le coronavirus.
Tout à fait, M. Fillon, la réponse était très claire. Hein. Les forces armées disposent de capacités d'intervention et d'appui considérables, et c'est sûr que leur expertise en soins de santé pourrait éventuellement être utile si les provinces le demandent.
Merci, M. le ministre. Une dernière question, Daniel Thibault.
Bonjour, Daniel Thibault de Radio-Canada. Peut-être pour M. Duclos, Mme Haidou. Compte tenu du fait que c'était prévisible ce qui est en train de se passer, de la situation qu'on voit à l'heure actuelle dans les centres pour personnes âgées, diriez-vous que ces établissements-là étaient mal préparés à faire face à la crise? Et compte tenu du fait qu'il y a 50% des décès rapportés qui se trouvent dans ces établissements-là, n'y aurait-il pas lieu de transférer peut-être une partie des ressources du secteur hospitalier directement au foyer pour personnes âgées?
Vous posez une très bonne question. Comme c'est une question de logistique et d'information plutôt provinciale et territoriale, je passerai peut-être la parole ou bien à Mme Haidou ou...
Peut-être je peux répondre en anglais, peut-être?
Absolument.
Parce que c'est difficile en français pour moi.
Do you need me to repeat in English, or are you okay? You got the translation?
I heard the question.
Okay, perfect.
I think your question is one, I think it's one that I answered earlier for another reporter, but I think I'll expand a bit because I think it's a really important question about the way that we value people who care for people. And I've talked about this a lot, and I'm going to step out on a limb and talk about it again today. And I was the Minister of Status of Women, as you know, when I was first appointed, and worked extensively on the gender wage gap. And you might ask, well, how does this even related? But it is actually related because, in fact, we tend to devalue the work of caring for people. And I think that this is an opportunity for Canada to think about how we value those who serve the most vulnerable in our societies, whether it is old people or whether it is children. And I used to wonder, when I was the Minister of Status Women, why it is that we valued more people who cared for vehicles than people who cared for people. And I think this is an opportunity for Canada to actually think a little bit more about how we will move forward with a stronger system of care for people who are aging. Because, in fact, all of us in this room are going to end up there, and these are our mothers and our fathers and our grandparents and our aunts and uncles. And most of us have had an experience of visiting someone that we love in a long-term care home. And there are some that are run very, very well, and it is not universally terrible. But there are others that really struggle, and some of it is around the way that we pay people, and some of it is the way that we care for those facilities, and some of it is the way that we conceptualize aging. And that is a large project for Canada, but it's one that I'm excited about, actually, because I think that in every crisis there's a silver lining, and the silver lining for us is, I think, collectively with provinces and territories to think about how we will move forward from this time and really refocus our efforts to make sure that everybody has an opportunity to age in dignity with the care that they deserve at the end of their life.
Merci. En question supplémentaire, peut-être, Madame Freeland, où est-ce que vous en êtes avec les négociations aux États-Unis, avec les États-Unis pour la réouverture de la frontière aux voyages non essentiels, et quel genre d'échéancier vous voyez se dessiner dans votre tête pour ça?
Quand nous avons mis en place les restrictions à la frontière canado-américaine, on a toujours dit qu'après 30 jours, on verra la situation. On travaille en étroite collaboration avec nos partenaires américains. On parle plusieurs fois chaque jour avec nos voisins. Le point de vue du Canada est que c'est trop tôt aujourd'hui pour parler du lever des restrictions. Comme le Premier ministre a dit ce matin, nous pensons que c'est le moment quand nous devons ajouter des outils pour être certains que les restrictions frontalières qu'on a mises en place sont vraiment obligatoires. Alors, ce n'est pas le moment. Je suis confiante qu'il y aura un jour quand on aura une frontière ouverte avec les États-Unis, avec tout le monde. Mais pour le moment, c'est le moment quand nous devons continuer de garder la santé des Américains, nos voisins américains, et aussi des Canadiens.
Merci, Madame la Vice-Première ministre. Ceci met fin à la conférence de presse. Thank you.
Hello again, Peter Van Dusen watching along with you. This update, the usual.